Moving on to number one. Here we go. The moment you've been waiting for. The cure is worse than the problem. My God, if this isn't clear. This is not just about economics. People say, well, it's just about your pocketbook. Donald Trump only cares about money when people are dying. You have to be an absolute imbecile to make that statement, okay? I'm sorry, I'm calling names. You're an imbecile if you think that letting our economy be destroyed is only about money, and the concern for that is only about money. We know that millions die if we have a lockdown. We have UNICEF and different groups all around the world saying millions that were on the poverty line, these children will now die around the world because of the lockdown. We also know that there are different models that say between 50,000, somewhere between 30 and 50,000 people die per 1 percentage point of increase in unemployment. Well, if we're talking about 20 to 30% unemployment, that means we may have over 1 million deaths here in America because of the lockdown. Compare 1 million deaths to our bloated number even of 100,000 deaths, or the 12,000 that we wink, wink really know that it is, and you have a catastrophic mistake. As they've said all the way back at number 10, the imperial model was a catastrophic mathematical miscalculation. We never changed our course, and now we are destroying our economy, and millions are going to have issues. We also know that millions are currently afraid to seek medical care, or their doctor isn't even working, because in the infinite wisdom of those suffering from CORONA-PHOBIA, they said, let's cut half of the hospital staff. Let's get rid of heart doctors. Let's get rid of oncologists. Let's get rid of those appointments with check to see if you have diabetes. This has been all over the news if your eyes were open.
People are so afraid of catching COVID, they're skipping treatments for things like heart attacks and strokes. And some Utahns are dying as a result.
Visits to hospitals, clinics, and surgical centers has declined 60%.
A new report finds that diagnostic panels and cancer screenings have fallen by as much as 68% since the beginning of the pandemic.
We're seeing a lot more both deaths and comorbidities and illness as a result of people not seeking care.
This time of year, the emergency room would normally see around 700 patients a day. But in the last 3 weeks, officials say they've seen half that number.
Just a few days ago, a woman at St. Mark's died in a diabetic coma. They could have saved her had she just arrived sooner.
According to the family, was just really hesitant to come in and get checked because she was afraid she might contract COVID.
The study warns that the isolation and the anxiety from the lockdown may be responsible for as many as 75,000 drug overdoses and suicides over the next decade.
If we didn't treat cancer patients for another 6 months, our calculations would be that something like 50 to 60,000 patients would die of cancer unnecessarily.
Well, yesterday that showed the death toll has increased from 112 to 325% above baseline, and that's certainly a lot more than the coronavirus alone.
One estimate says that over these 3 months, more than 80,000 cancers will be missed because of lack of colonoscopy, prostate screening, and breast cancer screening.
With the immunotherapy that's keeping his terminal cancer at bay now on hold, he's terrified he'll become one of the hidden victims of the coronavirus pandemic.
We're going to be facing these deaths of despair as we go forward. It may get really bad.
If you like that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, YouTube, iTunes, and Twitter. We'll see you there.